You are in the ladies' room with Dr. Donica, the only public ladies' room you can enter anytime without ever waiting online. I'm your host, Dr. Donica Moore. We'll be having real conversations with real women about really intimate issues. They may be embarrassing, sad, or funny, but they will always be interesting and informative. You know, like the best conversations you've had in ladies' rooms with your best friends, or total strangers and a physician. Please join us. Welcome, everyone, to the ladies' room. Today, we have a very exciting day planned because Valentine's Day is almost here, and everyone with a partner, or actually without a partner, is even thinking about hearts, flowers, jewelry, chocolate, and intimacy. But for many women, painful sex is a barrier to a fulfilling sexual experience on Valentine's Day or any other day. Now, everybody who's listening knows that I am a huge proponent of maintaining intimacy, not just because it's fun and sexy and should be fulfilling, but because it's also good for your body, your health, your mind, and your soul at any age. Well, any age over 18. This is especially true for women during and after menopause, a stage that can potentially, and in my case, I hope it lasts, for 40 years or more of a woman's life. During these years, however, certain sexual conditions can become a concern, and no, we're not talking about erectile dysfunction today. We're talking about painful intercourse, or the medical term dyspareunia, because we have to make everything more complicated than it is. We've heard a lot about the sexual challenges faced by men as they age, and they concern us, but now it's time to focus on our own issues. Not that erectile dysfunction doesn't also concern us. Now, painful sex as a result of menopause is a symptom of what we call vulvar and vaginal atrophy, or VVA. It's estimated that 50% of menopausal women experience VVA symptoms, and I have to say, the second I did, I called my gynecologist as fast as you could dial 1-800-GYN. But 40% of these women experience painful intercourse specifically due to the decline of estrogen, which happens as a result of menopause. Now, unfortunately, too many women think that a decrease in sexual activity is just par for the course after menopause. Our guest today, Dr. Laura Berman, wants women to understand the importance of identifying and addressing the issue of painful intercourse and of being proactive in preserving their sexual health and their intimate relationships. And that's certainly something we can all get on board with. Now, menopause only marks the end of menstruation. And for most women, that's a cause for celebration. But it also marks a major decline in estrogen production. This does not mean the end of sexual intimacy, although if you have symptoms of VVA, it may feel that way. Dr. Berman recommends that postmenopausal women can make several changes to their sexual routine that may allow them to maintain an active and pleasurable sex life, and we are going to talk about them. So unless you're driving, feel free to take notes. And we both strongly recommend that if these changes don't help, speak to your doctor about the treatment options that are available to you, and there are many. Now, without further foreplay for this topic, I am pleased to introduce Dr. Laura Berman. Most of you know her as a well-known sex and relationship educator and therapist. While you may not have had the pleasure of seeing her in her office, you have most likely seen or heard her in your living room, as she's a popular TV, radio, and internet host. In fact, I've even run into her a few times backstage at the Dr. Oz Show and the Steve Harvey Show, just two of the many places she frequents. Dr. Berman has helped countless patients build stronger relationships, improve their sex lives, and achieve a heightened level of intimacy via her website, drlauraberman.com, and her radio program, Uncovered with Dr. Laura Berman. She has a master's degree in clinical social work and a doctorate in health education, specializing in human sexuality from New York University. She subsequently completed a fellowship in sexual therapy with the Department of Psychiatry, also at NYU Medical Center. And in her spare time, she's the author of several best-selling books about sex and intimacy, and I hope you've read many of them. I have. Most importantly, she is the mother of 3 children. Without further ado, welcome to the ladies' room, Dr. Berman.
That was a lot of good foreplay.
Well, we all know, and I'm sure you advocate as well as I do, that the biggest sexual organ is the brain.
Absolutely.
So sometimes we need intellectual foreplay as well as physical.
That's the best kind sometimes.
And it depends on what you're talking about.
Right.
So of course today, that's going to be the best type of sexual foreplay, because today we're talking about women having issues with their sex lives just because of painful sex due to menopause.
Mm-hmm.
Now, of course, hot flashes are the most well-known symptom of menopause.
Right.
There are hundreds of others, but the one we don't really talk about that much is vaginal dryness or VVA.
Yeah.
So tell us, what you would like to talk about.
All of it.
Well, I just want to get right to the tips.
Yeah, right. Well, we can get to what, I mean, you already explained. Yeah, well, you already explained how it all works, right? And I loved your explanation. And you also talked about, I mean, I think you touched on the idea that really throughout our lifespan from the, our hormones, specifically those two hormones that play such an important role in our desire and sexual response, testosterone and estrogen, are slowly declining throughout our whole lives. But, as we move into perimenopause and certainly in menopause, postmenopause, which happens when you're, a year without a menstrual cycle, your hormones have basically bottomed out. That's what caused the menopause in the first place. And that's also what causes all the sexual side effects. But when you have painful sex, which is 1 in 3 women have in menopause, that is going to diminish your desire even more because, of course you're going to avoid it. And absolutely. For a lot of these women who have pain, it causes a secondary condition called vaginismus, which is that involuntary clenching, which of course makes the pain worse. And then you're kind of in a cycle. So
it also causes a fear.
Yeah, of course. It's a natural fear.
It also decreases your arousal.
Right.
And it decreases your own lubrication, what lubrication you may have left. So yeah.
Absolutely. Because when you're afraid or anxious or anticipating pain, your blood vessels constrict, and blood flow is fundamental to arousal, lubrication, comfort. So that's a big part of it as well. Absolutely.
So before we get to your tips, I do want to point out, a lot of people tune out when they hear menopause because they think, oh, I'm not old enough. This doesn't concern me. I'm not there yet.
Yeah.
Of course, the average age of menopause is 51. But anytime I talk about menopause, I always want to point out that there is a condition called premature menopause or premature ovarian failure that affects women under 40, and the average age is 27. So this conversation really is
not to mention surgical menopause or medical menopause after chemotherapy. If you had to have your ovaries removed or sometimes even your uterus removed, it will do a number on your hormones, right? And for some of these women,
I call that menostop.
Surgical
menopause is menopause in one day.
Yeah, and that's even worse, right? Because at least the rest of us get a gradual decline. But imagine, going overnight. But for both populations, I think what's so important to me is that we need to know, you don't have to suffer in silence. And certainly if it's a result of menopause, I think there's still sort of this grandmother's belief in there somewhere that, it's just a natural thing. I don't know. But the bottom line is, as you mentioned, it's so important for your health and your quality of life. And there have even been several studies now showing, and you've probably seen these or maybe even talked about them, that women, and it's interesting the difference between men and women, but women who are in a good relationship will live longer. And when they're in a bad relationship, they'll actually die sooner. Now, for guys, if they're in any relationship, good or bad, they're going to live longer. That's what the statistics show.
Actually, I love the study that shows that for the majority of men who are married, when their spouses die, they die they're much more likely to die within 1 year.
Yeah.
Now, I suspect that's because nobody's feeding them.
Right. Well, that's what they need, so for us, it's about the quality of the relationship, not just having someone taking care of us, right? It's really about the connection we feel. And sex is so important for that, as well as all the other health benefits, your immune system, cardiovascular disease, depression, anxiety, all of that, much of which you already mentioned.
Well, and many women talk about how sex after menopause is actually better.
Oh, yeah.
For the most part, you're now an empty nester if you're
right. You don't have to worry about anyone walking in. You don't have to worry about rushing.
You don't have to worry about getting pregnant.
You don't have to worry about getting pregnant. You often have more time, especially if you're retired or semi-retired, so you can take your time. So it can be a wonderful, one of the things that's so important to me in general is to get rid of this idea that menopause is the beginning of the end, because it's actually the beginning of the beginning. It's a time of reinvention. We're living so much longer and such vibrant, healthy lives. And anywhere else outside the Western world, menopausal women or women as we age become more revered, more admirable, more powerful, recognized for their wisdom and their clarity and being in their own bodies and knowing themselves. And that's the truth, right? And so now that girls are starting to run the world, we can claim this too.
Yeah, we're reclaiming our time.
Yeah.
And we used to say that menopause was the third chapter, but it's really the third, fourth, and fifth chapter. So we still have more Harry Potter books in the sequence here.
Absolutely. All the way to the end, especially in our sex life. You can have sex till the end of your life, assuming you can walk up 2 flights of stairs without chest pain. Like, that's the requirement.
Or you could just lie there.
Right.
No, actually, I mean, I'm joking about that. Of course, I'm wearing red today because today is Wear Red for Women's Day, and heart disease is a huge issue for women as we age. But in truth, men do need more cardiovascular capabilities than women to have a very active sex life. So we have that advantage. Anyway, I know everybody is really eager and poised with their pens to hear your tips for how to manage this and what to do about this. Right. And of course, the first thing is just recognizing that it's an issue, right? Because most
recognizing it's an issue, recognizing. Oh, you okay?
I dropped my glasses.
Okay, the two of us with our glasses.
Can't see you without them.
Recognizing that it's an issue, recognizing that you're not alone, and that every woman who goes through menopause is going to have some sexual symptoms. Getting rid of the shame and embarrassment, and talking to your doctor. And if your doctor blows you off or brushes you off, fire your doctor, get a new one. Because there are so many medical options available for women. And I'm actually partnering now with Duchenne USA, who are the makers of Aspina. I don't know if you're familiar with that.
Oh, I'm very familiar with Aspina.
Oh, good, because it's an FDA approved, once daily, hormone-free oral pill for moderate to severe painful sex. I do also just want to mention that there's a possible increased risk when you take it of endometrial cancer and cardiovascular disorders. So you want to talk to your doctor about that. But that's an example of a great option for dealing with painful sex.
Well, and that's one of the things I always talk about when I talk about Aspina, is that many women don't call their doctor because they think the only option is estrogen.
Right.
And while estrogen is a great option for many women, there are also many women who can't take estrogen because of a contraindication.
Or just don't want to.
Or don't want to.
Yeah.
So I don't want people to think that, first of all, your doctor is going to go right to a prescription of anything. Right. There are other things that we can do before that. And I love it anytime we have another option in our black bag.
Absolutely. And, obviously, lubricants, lots of foreplay. I'm a huge fan of organic coconut oil as an option.
Okay.
You can also just go to your local drugstore, get some KY products or anything else, try those out, communicate with each other, and also don't shy away from toys, because really, I always say any woman after 40 is going to struggle with, response a little bit. And so,
and especially if you don't have a partner.
Yeah.
Because some of the studies you mentioned from the Women's Health Initiative, we do know that the number one concern women over 50 have about their sex lives are women who don't have a partner.
Yeah.
So, there's that whole use it or lose it thing.
Yeah.
Of course, I always say, call your doctor if you have any medical problems. But I think the first person you need to talk to, I don't want this to have been lost in your list of tips. The first person is talking to your partner.
Absolutely.
They may think you're just not into him anymore. Or he may think, or she may think, that you're just getting to that age, and they may have bought into this idea.
It's just over.
Finished after 50. And this is just what happens. And now we're settling into a different kind of relationship.
Right.
So anyway, I know we're closing in on the end of your time.
Yes, I'm sorry.
Before we go, you have to tell me, what's the most unique, interesting, or different experience that you ever had in a ladies' room? Aside from this interview, of course.
Oh, in a ladies' room.
Yes.
I think it was when I was in a restaurant and someone was doing it with their partner in the stall next to me. That was kind of interesting. I think that's the weirdest thing that's happened in a ladies' room, because this was a man that got snuck in. But yeah, so that's it for me.
That's pretty interesting.
I know. Well, my life is interesting.
Or did you stay and do what you had to do?
I finished my business, and then I let them have their privacy. At least the door was closed and they were in a stall, right? So
well, if you're gonna do that, it should be in a onesie, not regular.
Yeah. Well, that some people get out, are into taken it to the next level. But yeah, awesome. Unfortunately, I have to go. But let me just tell you, go to drlauraberman.com because if you want more tips, so many, and definitely go to asfina.com to learn more about it. But also, I put a ton of what I call the Sexpectation tips on there.
I love that term.
Designed for menopausal women. And thank you so much for the work that you're doing. I'm sorry I have to run.
I'm so glad that you were able to zip into our ladies' room and have this conversation. I know lots of our listeners are really into it. We just had an interview a couple of weeks ago about losing your virginity after divorce, which was an extremely popular topic. I'm starting to think all my listeners want to hear about is sex. So this is great. Thank you very much. Anytime. And come back anytime.
Thank you.
Take care.
Bye-bye.
Bye-bye. That was Dr. Laura Berman with us in the ladies' room talking about sexpectations for menopausal women and the issue of vulvovaginal atrophy and vaginal dryness. This is an issue that's of concern to 50% of menopausal women, and we get a lot of questions about this. Of course, we didn't have time to go into all aspects of this with Dr. Berman, but I feel pretty qualified to continue the conversation. Of course, we want to continue the conversation on our Facebook Live chat every Wednesday at noon called Ask Dr. Donica, Your Most Embarrassing Questions. And we get a lot of questions about this. One of the questions we got about is whether vulvovaginal atrophy can increase your risk of yeast infections or other vaginal infections after menopause. And the answer is absolutely. So this isn't just an issue of comfort. This isn't just an issue of interfering potentially with your sex life. This is also an issue of interfering with all aspects of your day. Anybody who's experienced vaginal dryness or any kind of vaginal infection knows that there's a difference between vaginal dryness that just affects you during sex and intimacy versus what I call walking around vaginal dryness. And that is where some women talk about how their vagina actually feels like sandpaper when they're walking. And while your vagina is extremely important for so many reasons, it's not an organ you should really be aware of all day long. It's sort of like when you have a toothache. You know, your teeth are extremely important. You see them every day. Hopefully you take care of them very well. But if you have a toothache, that pain and that discomfort doesn't go away. Of course, it's worse if you're trying to eat something, or for some people, they might have cold sensitivity or heat sensitivity. And that's the same thing with vaginal dryness. It's something that may start as feeling just uncomfortable during sex. Of course, I know a lot of men think that's just because they're particularly huge, which is really not the case, because remember, even though they may be particularly huge, an 8-pound baby can come out of there. So I have yet to see a penis that rivals the size of an 8-pound baby. That having been said, with that little digression, certainly position can matter. Certainly, as Dr. Berman and I talked about, foreplay is extremely important. And as we age, foreplay or becoming sufficiently aroused may take a little bit longer. Sensation is actually a little bit decreased. You may prefer different things. And I think the most important thing Dr. Berman and I talked about is how critically important it is to let your partner know what's going on. Now, at any age, it's important to let your partner know if something doesn't feel right, or if something doesn't feel good, or something is just not as enjoyable as it might have been previously in your relationship or another night. I think there are also other tips about vaginal dryness for women who are in menopause or any age. There are other things that can cause vaginal dryness throughout the lifespan. For younger women in their 20s and 30s who may be on birth control pills can sometimes increase vaginal dryness, and that's something to be aware of. Taking antihistamines or allergy or cough, cold, flu products, which is a current issue right now. Many women take something called Benadryl, which is an antihistamine. It's the generic is diphenhydramine, which is a great medicine if you're having actual allergy symptoms. But it can also cause drowsiness, but it can also cause dryness just about everywhere. Using tampons can cause dryness. Obviously, not for women in menopause who shouldn't be using tampons, although I have also heard about women who have mild urinary incontinence who use tampons in order to decrease their incontinence symptoms. So if you're one of those women, please talk to your doctor about your incontinence. And we will be talking about incontinence. Yeah, of course, what better topic for us to discuss in the ladies' room is any kind of urinary problems. But if you're using tampons or sanitary pads because you have urinary leakage, please talk to your doctor about that, because there are many good solutions for that. Anyway, I think that I will just leave you with sort of an overview of how to handle vaginal dryness, whether you're in perimenopause or menopause. Many women can start having these symptoms much earlier. The good news is, while we talk about how 50% of women in menopause will have these symptoms at some point, that means 50% won't. Many of those women are on estrogen therapy, which does prevent and treat vaginal dryness, as well as prevent and treat vulvovaginal atrophy. And as I discussed in our previous interview with Leslie Jane Seymour, both of us came to that conclusion fairly quickly in our menopausal journey, because both of us have the personalities that, we don't want to suffer. We don't get any extra bonus points for that, regardless of what the symptom is, whether it's hot flashes, night sweats, mood swings, sleep disturbances, which for me was the number one consequence of menopausal symptoms. That was the most bothersome menopausal symptom for me. And a lot of women don't even know that is a menopausal symptom. But vaginal dryness is certainly a reason to go see your doctor. There are many women, however, as we discussed, who cannot take estrogen or who don't want any part of it because of the side effect profile. And absolutely every medical decision you make has consequences. If it's strong enough to have an effect, it's strong enough to have a side effect. Certainly Asphena, the medicine that Dr. Berman talked about, also has side effects. And that's something that you need to discuss with your doctor. But it does not have the same side effect profile as estrogen. So if you're somebody who's concerned about estrogen, that might be an option for you. However, many women just start with using a vaginal lubricant. So as we talked about with Sally Higginson in her Losing Your Virginity After Divorce interview, KY was good enough for her. There are also vaginal moisturizers, and we are going to talk in an upcoming episode of our Facebook Live, what's the difference between a vaginal lubricant and a vaginal moisturizer, and how do you know what's right for you? And then there may be other options. The point is, your sexual satisfaction is very important to you, not only because it's sexy and fun and good for your relationship, and intimacy is wonderful for just about every part of you, including your skin, which really does tend to glow when you're in a better relationship. So I hope I'm glowing right now. But it also is very important for your heart health, for your muscles, joints, and for just your overall well-being, your mental health, and your happiness, which is very important to us. Anyway, I hope you've enjoyed that session of In the Ladies' Room, and I will see you next time. Stay tuned. Bye-bye.
That's all we have time for today. But let's keep the conversation going on Twitter or Facebook at Dr. Donica. And please join us next week for another episode of In the Ladies' Room with Dr. Donica. Real conversations with real women about really intimate topics.